Under the assessment and service planning domain, I just want to touch briefly on asking people to really think about what should a trauma-informed assessment include. And as important as what we ask, in a trauma-informed organization, a lot of it isn't about what you say, it's how you say it. So in an assessment process, it's how can we conduct assessments in ways that reflect those trauma-informed principles. So how can we conduct assessments that are strengths-based, that are focusing on offering people as much choice and control as possible, of helping them to feel safe, of helping them to feel in control, of sharing kind of power within that dialogue. So I encourage you to think about that in your own organization, and some examples of some things that in a trauma-informed assessment would be helpful pieces to include would be certainly things, for example, like history of trauma or trauma responses. And the reason I say trauma history and responses is because this is a tricky one for us, and that I think understanding and knowing about someone's trauma history can be really helpful in terms of what referrals you make or how you treat them or what methods you choose or even how you respond. But I am aware that for a lot of people, particularly when they're just meeting you, sharing kind of intimate details about a trauma history could be incredibly overwhelming and very invasive. So for some folks, getting to what happened may not end up being the ultimate goal, but it still might be helpful to assess how what happened is currently affecting someone. And there are certainly tools and resources and even formal measures you can use to assess trauma responses, and level of trauma symptoms without necessarily having to go into a lot of detail about what specific situations those symptoms arose from. So that's really, I think, up to providers and organizations and your relationship with somebody, how you choose to work that in your assessment. It's important to ask about certainly current level of danger. Also to ask people about strengths, their support networks, their cultural and ethnic backgrounds, their current needs as they see them. And certainly I also put, for example, injuries, physical injuries, specifically head injury on there. I know for in the homelessness world, particularly for adults who've been homeless for long periods of time, there are also higher rates of things like traumatic brain injury and head injuries that can really mimic a lot of other symptoms that people might come to the table with. And we always say, and this happens a lot in the homelessness world, not to lose sight of the children. So, kids often need considerable support to hopefully mitigate the impact of traumatic experiences on their growth and development. So really devoting a segment of your assessment process to children, to mental health needs, to experiences of trauma or stress, to supports for kids, to parenting and attachment and what the quality of those relationships are is really key when you're serving children and families. When you think about setting goals based on the assessment, I think a more traditional approach really has the primary goals being defined by the provider and focusing on reducing symptoms, as opposed to a trauma-informed approach, which really sees primary goals as defined by consumers and focused on recovery, self-efficacy, and healing. The co-creation of written and sort of monitored goals really helps people take kind of control back. And I have definitely in times past tried to help set goals with families that they hadn't really bought into, and it was no surprise that they really struggled to meet those goals at the end of the day. So really trying to work with people where they're at as best you can within the systems that you're working in and the constraints, around really helping them build the skills and the strengths that they're identifying as wanting to build. So, again, really just think about the ways that you work with clients and how do you set the stage for really co-developing goals as opposed to kind of taking over that process in a more traditional way. And also, as part of the assessment and service planning process, whenever possible, offering trauma-specific interventions, either within your own organization or knowing others who have expertise in providing these. And these are mental health services conducted by people who understand and have expertise in trauma. Trauma education, whether that's in groups or individual for individuals or families. It's really helpful for people to understand kind of what's happening themselves. And opportunities for creative and nonverbal outlets. They're finding more and more with a lot of the research on the brain and its impact on trauma, and things that are supportive to positive brain growth and development, that creative processes and things like movement, whether in music or drumming or dance, have a lot of healing value to them. And for a lot of people who have experienced trauma often is held in the body in feelings and in images and in sights and sounds, but they're not necessarily put together into verbal stories. So nonverbal, more kind of arts-based outlets for people to express themselves can be really essential, not just for children, but for adults as well. The second to the last domain in the organizational self-assessment is around involving consumers. And really, in a trauma-informed organization, understanding that people have to be involved in their own care, and that they should understand how the program they're working in works, and being offered the opportunity to share kind of power and control in affecting change when you're working with a service provider. So some strategies around that from the organizational self-assessment include things like helping to develop peer support networks in your agency or in your organization, including consumers in the hiring process, including consumer reps on the board, hiring consumers on staff, involving consumers in their own treatment planning, involving consumers in the development of programming and the evaluation of programs, and involving consumers in the development of things like rules and any adaptation and policies. And that brings me to my last section in the organizational self-assessment, which is on adapting policies, and really thinking through your rules and your policies and procedures and starting to ask some questions, kind of putting on those trauma glasses and saying, is this policy or is this rule necessary? What purpose does it serve? Who does it help? Who does it hurt? Does it facilitate or hinder client control and inclusion? And were consumers included in its development? And I think those are great initial questions to ask when you're really struggling with whether to modify or adapt some sort of rule or policy that you have in your program. And some examples from the organizational self-assessment around trauma-informed policies are just things like having a written commitment to understanding trauma and engaging in trauma-sensitive practices, having a written commitment to demonstrate respect for cultural differences, to hire people with similar lived experiences to the people that you're serving in your organization, to having a policy outlining responses to consumer crises, to outlining professional conduct for staff. Some of these feel like basic things that a lot of organizations would have, but a lot of staff, I find, don't know what their policies are. They weren't involved in their development. They don't understand why they're there. So part of becoming trauma-informed might be to say, we're going to take this policy section and really look over all our policies and rules and procedures and kind of create a multidisciplinary team for figuring out what of those might need to be adapted. So in terms of next steps for sustaining these kinds of trauma-informed changes, some of the tips that we offer in the tool that we created are things like creating a trauma work group in your organization, so a team of people who might meet, even if it's monthly or quarterly, to see how you're doing on your trauma-informed goals. Having an ongoing review of your organizational practices. If you use an assessment or an evaluation early on, it might be doing a yearly re-eval and seeing kind of how you're doing, what changes you've made. Having ongoing opportunities for trauma training and making connections with other experts in the field who can help support you in your work. And overall, and I think a lot of what you're probably talking about at this conference as well, is really bringing trauma-informed concepts even beyond your walls into the broader systems of care that are serving a lot of the people that you're working with. So I want to end for today. I'm really grateful to have been able to talk to you with just a couple slides on tools and resources. And this presentation will be available, and we'll get you the information so that you can download it and see the slides and hear me again, and also take these tools and resources. So just two websites that you can kind of connect to. One is www.familyhomelessness.org. That's the National Center on Family Homelessness's website, and has the organizational self-assessment that I was referring to today, as well as a workbook for service providers around understanding some of the impact of trauma on the provider, as well as a few other tools and resources to help with becoming trauma-informed. You can also go to www.homeless.samhsa.gov and get some good information on training packages around trauma, information on trauma-informed services that aren't just homeless specific. So certainly if you work with people experiencing homelessness, this is a great resource for you. But I think even for people who are just generally interested in trauma-informed care, you could learn a lot from a lot of these resources. And finally, my organization, as well as our sister organization here, has created a joint training institute called T3, and I included the website here that you can go to and take a look at both our offerings for on-site but also online courses around trauma, motivational interviewing strategies, which I mentioned before, case management strategies, and several other courses, some that are more homelessness specific, if that's the type of work you do. I encourage you to visit it. Some of those online courses and modules are things that you could easily take or easily connect and have your staff take if you were interested in getting ongoing training in that type of way. So I'm going to end for today. My information is here. Feel free to contact me if you have more questions or more questions about the tools that we offer. Again, I really appreciate your time, and I hope you enjoy the rest of the conference. Thank you.